Hello. So many times in our practice, parents ask us about whether or not their child is a candidate for Healthy Start, and if they are, what positive results do we usually see? Now, as you heard me mention in the webinar, we generally treat children from ages 3 to 12. And as I mentioned also, it's a growth and development kind of issue, meaning if we can get in contact, diagnose, and set things up for children that are younger, we do have a much better chance of getting tremendous, almost 100% success rates when we see the kids at ages 3, 4, and 5. That doesn't mean that we can't get good results a little further down the road. It's just that the program is really set up to take advantage of growth and development. In terms of the kinds of positive results that we have a child that was in here just a few weeks ago, unfortunately age 15, suffering with bedwetting. I mentioned in the webinar how bedwetting can be controlled and even stopped by the use of the Healthy Start techniques. So I gave the young fellow the appliance to wear, and I talked with his mom about it. He was a little resistant, but then we found, he said, okay, let's give it a try. I called 2 or 3 nights later, or days later rather, to see how they were doing. And Mom said, well, he's still having a little trouble keeping it in, and I asked him, please ask him to stay committed, stay strong with this, it'll work. 2 weeks after that, I got a phone call here. I was working in the office, and they said, look, Catherine wants to speak to you. And I said, okay, hold on. I got up, went in my office, picked up the phone, and she said, hello, Dr. Dolfi. I said, hey, Catherine. And then it was dead silence. And I wasn't sure, and then I realized that Catherine was crying. And the reason she was crying is that she was able to finally get out to me that her son, after 15 years, had a dry morning. It was an emotional situation for me as well. We shared a few tears over the phone call, shall we say, and success has come to this young man, and in a good way. He's been committed to it. We always say to parents, if they wear it, it will work. Meaning, if they'll wear the Healthy Start appliances, the mouth guards, I can almost assure you that the results are going to be positive. Just a couple of days ago, we had a patient last week, a 3-year-old little guy. Very difficult sleeper, restless, throwing things, oftentimes wouldn't even get to sleep. His mom reported incidents of him gasping, and almost, she thinks he wasn't even breathing at certain moments during the night. Took a little while. We worked with him, we talked with him, we got Mom to help, and sure enough, he started wearing the appliance. I actually saw him today, this morning, in the office, and you can't believe the difference. His mom was ecstatic, of course, because the child was now sleeping all night. He's waking up in the morning just so much better, and interestingly enough, last night he reported to Mom he wants to wear the appliance before bedtime. He actually asked for it. Hey, can I have my mouth guard? Another result there. Now we're talking about a 3.5-year-old versus a 15-year-old. Now, in the middle there, when you have kids 7, 8, 9, 10, we can certainly help extinguish any habits that are associated with sleep disorder breathing. That just ends up making an even better version of your already wonderful child. Don't forget, we have a dental solution for a medical problem. Whether it's signs and symptoms of ADHD, something drastic like bedwetting, fidgeting, nervousness, having trouble in school, all these things can be helped by the use of the appliances. Now remember, the key issue is good quality sleep. I talked about in the webinar how we want the children to go through those cycles of sleep, and particularly REM is most important. If we get them lips closed, breathing through the nose, they will go into REM sleep, and suddenly they become a whole new child. And that's, of course, our goal, to help as many children as we possibly can. If, in fact, in your area, or let me back up, if, in fact, you think your child has any of the symptoms I mentioned in this webinar, please get in contact with a dental professional in your area that is a certified Healthy Start provider. If you can't find someone, call the Healthy Start or go online, go on Facebook. Reach out to us because we're here to help you. Thanks so much. Bye now.